Well, I tell you what, I'm fed up with COVID-19. The problem is COVID-19 isn't fed up with us.
Well, I agree that hindsight is a great thing, but rewriting history isn't a great thing, is it? Britain's Prime Minister, Boris Johnson, is under fire once again, not least from members of his own Conservative Party. At issue, his handling of the pandemic, Brexit, and a string of U-turns on key policies. My guest this week here in London is one of his junior MPs, Bim Afolami, elected to Parliament 3 years ago. Can Mr Johnson halt his current slide in the opinion polls? And what will the party do if he can't? Bim Afolami, welcome to Conflict Zone.
Good to be here.
I want to look first at the government's handling of the pandemic in recent months. We know that a vaccine now appears imminent. But after a decade of Conservative rule, Britain was woefully unprepared to deal with this pandemic, any pandemic, wasn't it? Despite numerous warnings and dress rehearsals. Why was your party asleep on the job for so many years?
Well, I think what we saw with the pandemic was that the vast majority of countries found themselves unprepared for it. And the reason for that, the fundamental reason for that, was that the nature of the pandemic wasn't quite what was previously expressed, what was previously expected. What was generally expected by most countries was something that resembled flu.
I realise it was different, but look at the figures. Before the coronavirus hit, the UK had just 6.6 intensive care beds per 100,000 people. That's fewer than Latvia, fewer than Cyprus, half the number that Italy had, and about a fifth of German capacity. Fifth largest economy in the world, and the provisions for intensive care were woefully inadequate, weren't they?
Well, if you're talking about intensive care beds, there's clearly a point around excess capacity and how much is sensible to maintain. I happen to know that there were people from the German health system who've visited the NHS, this is all pre-pandemic, to talk about how they could manage their capacity more effectively. So I think that both of us can learn from each other. Indeed, most health systems can learn from each other.
Well, you claimed in May that the government had been as decisive and prompt as it could have been in meeting the challenge, but that's not a widely held view among the government's scientific advisers, is it? The UK's chief scientific officer, Patrick Vallance, admitted that, didn't he? He said in July, it's clear the outcome has not been good in the UK. I think you can be absolutely clear about that. Are you now absolutely clear about that?
Well, the outcome has not been good because many thousands of people died. So anybody who says the outcome was good is wrong.
Well, Sir Ian Boyd on the SAGE committee on the Scientific Group for Emergencies said if the government had acted a week or two earlier, it would have made quite a big difference to the death rate. So the government still can't bring itself to admit that, can it? Why not?
Well, the truth is that hindsight is a wonderful thing. And the scientific advisors have given, and look, I've got huge respect for them, they're doing an incredibly difficult job, but they gave at different times contradictory advice. I remember when they were saying that masks shouldn't be worn. Now the advice is to wear masks. Why did they change that advice? Not because they're incompetent or said it wrongly, because we learnt more about the virus as time went on, in the same way that governments have learnt and politicians have learnt and civil servants have learnt more about how to manage this as time went on. And as I said at the beginning, we do need to learn lessons from this around how we manage our excess capacity with beds, how we manage our state capacity around testing and various other things. But, this really, really was an unforeseen crisis in many respects, hence why the things that we're grappling with in this country are the same things that all across Europe and indeed the world governments have been trying to manage.
Well, I agree that hindsight is a great thing, but rewriting history isn't a great thing, is it? This claim by the government that everybody who needed care was able to get that care, this from the Health Secretary, Matt Hancock, in July, that wasn't backed up by the facts, was it? Thanks to a Sunday Times investigation, we now know that a system, or triage tool, as it was called, had been devised, which meant that many people over the age of 60 were denied the life-saving treatment they needed. There's direct testimony from doctors to back that up. So the truth of the matter is somewhat different to the way the government now portrays it, isn't it?
Well, that's not my understanding of it. My understanding of it is, of course, in any healthcare system, like of a country like the United Kingdom, there is a judgment that doctors make at different times around what's the appropriate treatment. And of course, at times of stress, then there were times when they wanted to not necessarily keep people in hospital for as long as they otherwise might because of the huge pressure on the health service. But that was the same problems we're seeing in lots of countries.
This blanket version that everybody who needed care was able to get that care, it's not true. Dr. Rinesh Pirama, chairman of the Doctors Association UK, said the late lockdown, first time around, allowed the infections to spread across the country more than the health service could cope with. Staff, he said, had to tell many critically unwell patients who needed life-saving treatment that they would not receive that treatment. That's not the same as everybody who needed care was able to get that care, is it? There's a big difference there.
Well, of course, you've got lots of people now saying, oh, if only the lockdown could have come a week before or 2 weeks before or whenever.
No, but people were denied the treatment, Mr. Afolami. They were denied treatment. They were told. The same from the chairman of the British Medical Association, Dr. Chan Nagpur, said the same thing. It is manifestly the case, he said, that large numbers of patients did not receive the care that they needed. And that's because the health service didn't have the resources. Can't be clearer than that, can it? Exact opposite of Mr. Hancock's blanket assurances.
Well, I don't think anybody denies that in June, July of this year, the health service was under huge strain. And look, I can't talk for every individual case. And of course, in some hospitals, they had to make very, very difficult decisions around who got treated in what particular way, how quickly, and so on. But I think that the idea that somehow, if only the government had done the blanket lockdown a week earlier, then none of these problems would have occurred, I think is wrong. I also observe when I look at other countries, yes, some countries went into lockdown earlier, but then they had significant surges later on in the year at a time when the United Kingdom didn't have it.
There's a basic issue of trust here, isn't it? If you can't trust the government to admit to mistakes or failures, then you certainly can't trust it to learn from them, can you?
Well, I think you make a very valid point around the tone of how we talk about this. And I think that we need to, and actually I think the way the government's approached the news of the vaccine has been very muted, very calming, in not sort of saying, oh, it's all over, it's all going to be fine. I think that that's a good tone to have when you've got something so unexpected and difficult as a sort of killer virus that people still don't fully understand. And yes, I think that earlier on in the pandemic, there was a tendency sometimes. I think that politicians generally can often have this tendency, which is to always show the best case scenario.
Well, it's to whitewash and to try and escape.
And not always level with everybody about some of the difficulties that occur.
But that's appalling, isn't it? That's an appalling admission, because at a time of an international health crisis, you would think you could get the truth from the government. And they've been They've been hauled over the coals by the statistics watchdog time and time again for putting out shoddy data, haven't they? In June, the head of the Statistics Authority accused the government of continuing to mislead the public over the number of COVID tests carried out. The aim, it says, seems to be to show the largest possible number of tests, even at the expense of understanding. Last week, the Office for Statistics Regulation warned that the use of data has not consistently been supported by transparent information provided in a timely manner. And you're happy about that, are you?
Well, I think that the difficulty with data is that statisticians will have very long arguments about how best to present something, or how rigorously one might argue to present something.
This is the government's watchdog. This is the government's own watchdog saying that.
Well, it is the government's statistical watchdog. However, the way the statistics are put out, they're put out from the Department of Health or number 10 Downing Street. Actually, the speed with which we're trying to put out the information for people sometimes means that the statistical authorities do not have the time, or are not given the time, to fully put their view of how that information could be best presented. That doesn't legitimate. And of course, you can have an argument. I've sat on parliamentary committees where we spent hours debating about how the right way is to present something, because statistics can often be presented in different ways. I don't think at all that the government has done anything other than try and present as much information as quickly as possible to the public. The only failing...
Well, then it hasn't done a good job, has it? If its own watchdog is hauling it over the coals. You said in July the government's efforts to date to tackle COVID-19 have been rather impressive. Would you like to revise that opinion, given some of the things that we've been talking about?
Well, No, I was talking about the government's act. The government did everything it could. And of course there were mistakes made, and I've never denied that, but there were mistakes made in every single country.
Yes, but they're not admitting them, are they? They're not admitting them. They're still rewriting history. They're still saying that everybody who needed care got it. Well, that's manifestly untrue from the frontline doctors.
I'm afraid that's not true. If you take the issue of testing, for example, I've seen the Health Secretary in the House of Commons repeatedly say, look, we know we aren't testing enough people. We're trying to increase the number of tests we're having, for example. I've seen the Chancellor get up and say, look, we've done this to respond to the economic challenge, but actually now we're going to add to that, because I've listened to people and I've heard that we need to support other people in different ways, and we're going to add this. I don't think that the government has been sort of blinded as to getting everything right first time. I don't think anyone's pretended that.
You've even had criticism of their data from the former Prime Minister Theresa May. She said last week, for many people, it looks as if the figures are chosen to support the policy rather than the policy being based on the figures. That's a crushing indictment from such a senior figure in your party, isn't it?
It is a crushing indictment. And what she was referring to in that debate was she was referring to the chief medical officers, their data in relation to the sort of month-long lockdown that England has now been brought into. And these were the same people, as you quoted earlier, criticising the government. I suppose why I'm saying this is this has been a moment of unprecedented stress on the British state, the British health system, and sometimes everybody within that system has sometimes got things wrong. But I do not believe that is in any way a judgment on the motives. I think that on some level, the speed and the strain with which people have been put under has meant that sometimes the data may not have been correct at a particular point. But nobody has ever suggested or should ever suggest that somehow the government hasn't tried to give the best quality information at a timely manner.
Well, you say that, but the fact is that very vocal and senior members of your party are now fed up with the government and saying it publicly, aren't they? They're fed up with
the lockdown.
They're fed up with the bluster, the boosterism, the gross exaggerations that have no basis in reality, and that shoddy data. Aren't you fed up with all this as well?
Well, I tell you what, I'm fed up with COVID-19. The problem is COVID-19 isn't fed up with us. And I'm fed up with the lockdown. I want to be able to do everything I want. And
You're not fed up with the U-turns, the constant U-turns on policy? We had at the end of August Charles Walker, vice chair of the 1922 Backbench Committee, who said it's becoming increasingly difficult to promote and defend government policy, as so often that policy is changed or abandoned without notice. The climate of uncertainty it creates, he said, is unsustainable. This is one of the big beasts of your party, actually coming out now and saying, enough of this. Enough of these U-turns.
Well, he is, and I've got huge respect for Charles, but I think that's a bit over the top. I think that actually what has made us fed up, as I said, is the lockdown, because nobody wanted to go back into that situation, and reluctantly the Prime Minister had to take that decision. The Prime Minister did not want to take that decision, was forced to. And the result of him having to take that decision has made a lot of Conservative MPs frustrated, because in the Conservative Party we do not like infringing on anyone's liberty, and that has made a lot of people frustrated, myself included.
Yes, and a lot of people in the country, a lot of people in the country aren't impressed either. According to YouGov, 69% of the country thinks this government has handled the pandemic fairly badly or very badly. Only 3% think it's done very well. Ipsos poll is asked if Boris Johnson is incompetent. A resounding 54% said yes. Do you share that view?
I'm afraid opinion polls will tell you one thing one day and something else the other.
I know, but your party is keen to quote them when they like them, don't they?
The judgment on how we have done in managing this virus really will only be able to be made once the whole crisis is over. I remember when people at the beginning of this crisis were saying that Sweden were making terrible mistakes. Then through most of the summer, people were saying Sweden's got everything right. Now some people are saying, oh, well, Sweden's having a surge. Maybe they made some mistakes. The truth is that only at the end of this will we really be able to judge how each government has managed it. And it's very, very difficult in the moment to do it, especially when so many people have died and so many jobs have been lost. So
Mr. Afolami, it's very convenient to push the judgment onto some period when perhaps the Conservative Party is out of government and not deal with things now. But the opportunity to learn lessons is now. And we know, you mentioned the test and trace system. Well, that's been a fiasco, hasn't it? After misstarts and U-turns, Dido Harding, who runs it, had to apologise. The Prime Minister talked about the failures of it. Fact is, your party spent gigantic sums, around £10 billion, on a system that doesn't work. How do you explain this shattering figure?
Well, I think that the difficulty with test and trace is the two parts to it. The test bit, we've actually made huge strides. The difficulty was the tracing and the isolating of individual contacts. I happen to think that our trials of mass testing are going well in Liverpool and elsewhere. Once that is rolled out, and it be rolled out quite soon, I think that trace bit will be a lot easier to do. And so what I hope will happen actually now going forward, and this isn't minimizing the difficulties with it, which you've described, it's just that going forward now, I hope that trace bit of that test and trace system will be improved. But look, spending billions of pounds on something that isn't as effective as you like is not a good thing to do. And of course we didn't want that. I look at a country like Germany, where people were hailing Germany for the quality of its test and trace system. And yet Germany went into a national lockdown a couple of weeks ago because they had a surge in cases.
But Mr. Afolami, there are important questions about some of the companies brought in to run this test and trace system. The biggest beneficiary was a company called Serco. Isn't it odd that the government paid hundreds of millions of pounds to this company that was fined over £19 million last year for misconduct in its tagging service for the Ministry of Justice? Apparently that misconduct included charging for offenders who were dead. Nothing odd there that this company is rewarded with a massive contract now by this government? Do you honestly think it's acceptable to reward a company with contracts like that when it has a record of the kind I've just described?
Well, when I was on the Public Accounts Committee, a public spending watchdog here in Parliament, I looked at Serco in immense detail and have looked at exactly how they do things. And of course, sometimes they've made mistakes, as you made the point around Ministry of Justice. But of course it is right and completely proper to give a contract to a company who is trying to deliver what it's been asked to do. And nobody is saying that the reason why the test and trace system is not perfect is because of Serco. It is because of the huge complexity of doing what this country is trying to do, and indeed what lots of other countries are also struggling with doing. It is wrong to suggest that somehow there's something illegitimate about using an effective, efficient private company to try and help deliver public goods. Because if you don't believe that any private company should be involved with any public goods, then you should say so.
Well, you've set an interesting precedent here. A record of gross misconduct is no bar to getting contracts from this government. I'm puzzled that you find that acceptable when there are so many countries out there that don't have records of gross misconduct.
Well, it's not about when you tender for a contract as a government, you put out for tender and you will examine that on its merits or not. If the decision if the contract should have gone to another company, by all means, that's an argument that one can have on the basis of the evidence that's presented as to maybe why another company may have been able to do it more effectively. But it's wrong to say, because one thing in the huge number of contracts that Serco has with the British government over many, many years, the one area where things have gone wrong in relation to an unrelated area, Ministry of Defence or Ministry of Justice, somehow makes it that Serco should never, ever deliver a project for the British government. I think that's a wrong thing to do. What you've got to try and do is work with our private sector partners to get the best outcomes at all.
And you've got to have accountability,
well,
haven't you?
I do think we have to do.
You've got to have accountability, and this is something that the government manifestly doesn't like. We saw at the beginning of October, Health Secretary Matt Hancock was in the House of Commons. Maybe you were there too. He was asked by an MP about the difficulties of getting tests for his constituents. But instead of offering a full and frank answer, Hancock told him, "I will not have this divisive language. I just won't have it." He then sat down without addressing the question at all. I'm wondering, do you think that kind of arrogance is acceptable from a minister who, last time I looked, was a public servant paid for out of the public purse? Do you think that's an acceptable answer? I will not have this divisive language. I just won't have it. To a perfectly innocent question about testing in this man's constituency?
Well, look, I don't recall the exact question that you said, so I can't comment on that. What I can say from what you've told me is that sometimes the House of Commons can be a very heated place, and I'm sure, and I've always, whenever I'm in the House of Commons, I always, try to remain as calm as possible, but I'm not under the stress that the Health Secretary is currently under. And so I think, bearing in mind how much time he spent on his feet in the Commons, how many questions he's answered, if he's been sort of inadvertently stressed when he's answered a particular MP, I don't think that should be a hanging offence. I think that he's under stress like many people at the top of government, and I'm sure, and I know that the Health Secretary is doing absolutely everything he can to improve the situation.
We understand stress, but we also understand that if you are stressed and you say things like that, you can apologise later. As far as we know, there was no apology to the gentleman concerned after this.
I mean, the Health Secretary can speak for himself. What I would just say, to stress again, is the House of Commons can be a pretty aggressive, loud place, as it should be, because it's a vibrant democracy that we have, and sometimes things come out not quite in the way that you otherwise would have liked. So I don't think that we should condemn either the person asking the question or the Health Secretary for particularly intemperate language on one occasion.
Let's talk, if we may, about Brexit briefly. This came to a head in September with the government's declared intention to breach international law and renege on parts of the Brexit withdrawal agreement relating to Northern Ireland. Spectacular act of bad faith, wasn't it, at this point in the negotiations?
No, I don't think it was an act of bad faith. Actually, what this were three particular instances of making sure that in the event where there was no Brexit deal, and in the event that the dispute resolution mechanisms that we have under the withdrawal agreement do not reach an outcome, we had to make sure that the unity and the coherence of our own United Kingdom was intact. And that
you could have made sure of that before signing the agreement last year. You signed it in good faith, and you intend to break it in bad faith. There are ways of changing the text of this, if you wanted to, by dispute resolution, but you chose to do it unilaterally. And this was too much for the government's top legal official, Sir Jonathan Jones, who resigned in protest. You've got an avalanche of criticism from Tories about this.
Well, what actually is the case is this would only come into effect if there is no agreement, trade deal, if the dispute resolution mechanisms are completely exhausted. So this would only occur, these clauses would only come into force in the unlikely situation that those two things were the case.
Well, you've got an obstacle with the new Biden administration in the US, which takes a similar view as the EU. They've already slammed this decision to renege on the withdrawal treaty. Is Boris Johnson going to have to go cap in hand to the US and offer one more U-turn, another day, another policy reversal? Pretty humiliating, isn't it?
Well, I'm pretty sure that the Prime Minister will get on well with the new president. And I'm also sure that regardless of their personal relationship, the institutional reasons why Prime Minister of the United Kingdom and the President of the United States become and work closely together is because of the deep relationship between our two countries. So I don't believe that. My understanding of what the Biden team was worried about was the idea that somehow we would compromise the Good Friday Agreement in Northern Ireland. And we've been absolutely resolute about the fact that the measures, in fact, help to bind our United Kingdom closer together. And we absolutely will not compromise on the Good Friday Agreement.
Well, nobody believes that because you've reneged, or you're intending to renege on an international agreement. Only rogue countries do that, don't they? It's hardly something that the British government wants to be known for around the world, but it is now. Its word doesn't count for anything. It signs an agreement and then a few months later says, I'm not going to abide by that. What trust do you think can be ever invested in the British government again while it's looking for trade deals around the world?
Well, we've recently signed a trade deal with Japan that was a very comprehensive free trade deal. Frankly, it went further than most people, myself included, expected in areas like...
the EU got out of it, out of their trade deal. It wasn't as good as the one that the EU has with Japan.
I reject that, actually. If I look at provisions in particular around financial services, they are much further than what the EU has with Japan. And if you're the broader point around trust, look, it's an important one, and I won't repeat, the very remote scenarios in which these particular clauses may come into effect. But a lot of the problem with this was actually and I think the government and Conservative Party does need to own this, is around how we communicate what we're trying to do and make sure that people do not think that somehow it's our intention to break all these international agreements. Now, I'm not blaming the media for that. It's our fault. We need to communicate much more carefully, much more effectively why we're taking certain actions. And if we do that continuing going forward, then I'm hopeful that there will be no breakdown in trust with this country. And as I say, the Japanese government doesn't seem to think that there's a breakdown in trust with Britain either.
All right, Bim Afolami, it's been good to have you on Conflict Zone. Thank you very much indeed. Thank you.